Hi, my name's Carter Freeman. I'm Vice President with vcfo, Vice President of the Western Region. With me today is Kelly Phillips-Henry, CEO of Aurora Mental Health Center. Kelly, welcome to vcfo Conversation.
Thank you, Carter. It's great to see you and great to be here.
Well, tell us more about Aurora Mental Health Center, your mission and what you guys do and what you're all about.
Yeah, so Aurora Mental Health Center has been around over 50 years, obviously in Aurora, Colorado, and we serve everything really in eastern part of Denver. Been around a long time. Started as a very small program that serves children after a woman in the community was driving home and saw a small child or two in the street without any parental supervision, and stopped and started to ask some questions, and the kiddos clearly needed some help, and that began what was a child support program that took on many other entities and acquisitions over the years to create it as one of the largest community mental health centers now in the state of Colorado. And so, yeah, really happy with what we do. And, I'll just share one more thing, Carter. As we continue to see more tragedies occur in our country as we come out of this pandemic with shootings, unfortunately, our community was victim to one of those very large shootings, the Aurora Theater shooting, back in 2012.
That's
and
right.
It was our center that, we provided all of that mental health response, not only then, but we continue to do it now. We made those services free for everyone involved in that theater. We continue to see many folks, and we are really a part of that community footprint.
I also understand that the way you manage an organization, you have four facets that you look at, four lenses, if you will, that you look at the organization through, that you'd use for any organization, and then a fifth one specific to a nonprofit, if you could, or a community nonprofit, if you could speak to those.
It's interesting. There are people who truly will say, "Oh, you're a not-for-profit, right? You don't ever have profit." And
Right.
I always try to explain to folks the only difference between a not-for-profit and a for-profit or a privately held company is what you do with that bottom line. And I certainly don't budget to be in the red at the end of the year. And we certainly target what we want to be our net so that we can do important things in our community with reinvesting those dollars. So with that, I think that one of the things that I have brought to the center is we need to understand that we are a business and that we are fiscally responsible for maintaining this business for our community. Our community depends on us. And so I am a big fan of Vern Harnish and the work that's done by the Gazelles. So I bring a lot of that into our strategic planning. And so, what I tried to do in the beginning is to really create a cadence of, and I know this sounds pretty simplistic to many organizations, but we need a strategy. And that was something when I looked at their strategic plan, it was like, boy, we really need to do some enhancements to how we think about this. And so working with the board, working with the executive team, and a lot of our leaders across the company for their input and buy-in to a strategic process that had us think not only within a 1 year, what are we trying to accomplish in this next year, but how does that cascade from what we deemed as a realistic, larger frame, which in healthcare is changing so rapidly that we tied that to 3 years. And so really that was helping the company try to get a hold of where are we going. And there was a lot of questions from staff that with my transition, they really didn't have a sense of where we were headed. And so that is always kind of step one, which I think for a lot of organizations it is that visioning and then that strategic planning. We created an envisioned future, which I think has been a super helpful document for us to think about 10 years from now, what do we want to look like? So those were the key pieces we started with. And then from that, Vern Harnish talks a lot about getting to structure. And so having a cadence of as you create that annual strategic plan, then does it align to your structure, to your organizational layout? Are there things you need to be creating? Are there things, maybe business lines, that really no longer serve a purpose and you need to help transition and put them out to pasture? And so we are now in a cadence of doing that review annually. And that then leads to people. How do we make sure we're taking care of our people? So we go back and make sure that we're looking at our benefits, that we're looking at pay equity, that we're providing competitive wages, that we're looking at what the staffing needs to be. That probably is the biggest pressure point I'm feeling right now, post-pandemic, is workforce challenges. And I have staff saying to me, "Uncle, I'm crying uncle, man. I need more colleagues to help me do this work." So, we really take a deep look at that. And for us this year, that's going to really require us to think strategically about recruiting. And then obviously comes financial health. You need to tie it to your budget. You need to make sure that you've got sustainability. Again, to be a fiscally responsible not-for-profit in our community. We serve over 30,000 people annually. And so if we went belly up, those impacts would be felt large and wide. And so deep and wide, I should say. So, we want to make sure that we've got a plan, not only for operational budgeting, but for capital improvements, for the facilities we operate. Again, going back to competitive wages. And then what do we need to do with some of those dollars to invest creatively in the next big thing, that future, that innovation? So those are really the conversations we're in right now as a part of our fiscal year that begins July 1. So those are the big ones that I think very clearly come from a lot of Vern Harnish's work, and certainly scaling up has been a big piece of my belief in how you grow and expand a business. But I think there's one more, and you spoke to 5, and so I'll mention the 5th, which is, I think when you are also a not-for-profit and embedded in a community, how your mission translates from what you're hearing from the community need, and aligning those services and being a strong partner with your county commissioners, your police department, your sheriff's department, your city council, the work you do with the mayor, the work we do with the other very large not-for-profits that collectively with us serve the safety net. And how do we bring folks and be the convener in our community to address community issues, I would say is the 5th. And that is equally as important to us in terms of our role being a leader in a not-for-profit that helps us expand our touch and our reach.
I see. Certainly makes sense. Well, you certainly are on a mission and lead an organization that's vital to the health of our community. I'd like to thank you for joining me on VCFO Conversations today. It's been great having you.
Carter, it's always great to see you. You're always a fantastic lifeline for me when I need it. And I just wish you guys the best. And you've helped my organization get to the best. So thank you.
Thank you.